Welcome to G Fun Facts Online. Today, we're traveling back to 1998 to a quiet village named Sungai Nipah in Malaysia. This village, once unknown to the world, would soon lend its name to a terrifying new disease. This was humanity's first encounter with the Nipah virus, a deadly pathogen that jumps from animals to humans. In the years since, it has caused sporadic, devastating outbreaks across Southeast Asia, serving as a chilling reminder of the ever-present threat of zoonotic diseases. What makes this virus so dangerous? How does it spread? And what are we doing to stop a regional threat from becoming the world's next pandemic? Join us as we uncover the story of the Nipah virus. The story begins not with people, but with pigs. In late 1998, pig farmers in peninsular Malaysia noticed their animals falling sick with a strange illness. The pigs developed a severe cough, often described as a barking cough, and neurological symptoms. The disease spread like wildfire through the piggeries. At first, authorities suspected Japanese encephalitis, another virus common in the region that can cause brain inflammation. But this was different. Soon, the illness jumped to the people working closely with these sick pigs. The human symptoms were terrifying. It started like a bad flu, fever, headaches, muscle aches, but it quickly escalated to severe encephalitis, an inflammation of the brain that causes confusion, dizziness, seizures, and can rapidly lead to a coma. By the middle of 1999, the toll was staggering. Over 265 people had been infected, and 105 of them had died. The virus didn't stop at the Malaysian border. It hitched a ride with infected pigs being exported to Singapore. There, abattoir workers who handled the imported animals began to fall ill. 11 cases were reported in Singapore, with one tragic fatality. The economic consequences were immense. To halt the outbreak, authorities made a drastic decision: a massive cull. Over 1 million pigs were euthanized to break the chain of transmission. It was a brutal but necessary measure. And it worked. The culling successfully stopped the outbreak in both Malaysia and Singapore. But the world was now aware of a new viral enemy, and a critical question remained: where did it come from? Scientists embarked on a high-stakes investigation to trace the virus to its origin. The trail didn't lead them to pigs as the ultimate source, but to a much more elusive creature of the night: fruit bats of the Pteropus genus, more commonly known as flying foxes. These large bats, found across Asia and Australia, are the natural reservoir for the Nipah virus. This means the bats can carry the virus and shed it in their urine, feces, and saliva without ever getting sick themselves. They are perfectly adapted hosts. The prevailing theory for the 1998 outbreak is that environmental changes, possibly linked to deforestation and drought, pushed these fruit bats out of their natural habitats and into agricultural areas. They began roosting in fruit trees located directly over or near pigsties. The pigs then likely became infected by eating fruit that had been contaminated by the bat's urine or saliva, or by direct contact with bat droppings. The pigs acted as an amplifier host. While the virus might jump from a bat to a single pig, the close, often unsanitary conditions of industrial pig farming allowed the virus to spread rapidly among the pigs, amplifying it to a level where it could easily spill over into the human population. The mystery of the origin was solved, revealing a complex ecological chain from bat to pig to human. Understanding how Nipah spreads is key to preventing its transmission. We've seen the first method in action: direct contact with infected animals. In Malaysia, it was close contact with sick pigs. But as more outbreaks occurred, scientists discovered other, even more insidious routes. The second major pathway is through contaminated food. This became particularly clear in outbreaks in Bangladesh and India. A common source of infection there was the consumption of raw date palm sap. This sap is a popular local drink, often collected overnight in clay pots hung from palm trees. Unfortunately, fruit bats are also fond of this sweet liquid. They would visit the pots at night, drinking the sap, and contaminating it with their virus-laden urine or saliva. People who drank the raw, unheated sap the next morning were unknowingly ingesting a deadly virus. The same risk applies to any fruit that has been contaminated by bats. This is why a key piece of public health advice in affected regions is to never consume fruit that has bite marks or has fallen on the ground. But perhaps the most alarming aspect of Nipah virus is its ability to spread directly from person to person. This isn't always the case with zoonotic viruses, but Nipah can do it. Transmission occurs through close contact with an infected person's bodily fluids, including saliva, respiratory droplets from coughing or sneezing, urine, or blood. This mode of transmission has been a major driver in outbreaks in Bangladesh and India, especially within families caring for sick relatives and in healthcare settings where infection control measures were not strictly followed. This human-to-human capability is what makes health organizations so worried about its potential to cause much larger, more sustained outbreaks. An infection with Nipah virus can manifest in a terrifyingly wide spectrum of illness, from no symptoms at all to a rapidly fatal disease. After a person is exposed, there's an incubation period, typically ranging from 5 to 14 days, though it can be shorter or much longer in some cases. During this time, the person feels fine, completely unaware of the virus replicating inside their body. The initial symptoms, when they appear, are often nonspecific and easily mistaken for other common illnesses. They include fever, a persistent headache, a cough and sore throat, muscle pain, and sometimes vomiting or diarrhea. It sounds like a severe case of the flu. However, for many, the disease takes a dark turn. It progresses to severe neurological and respiratory complications. The hallmark of severe Nipah is encephalitis. The inflammation of the brain leads to drowsiness, intense dizziness, mental confusion, and altered consciousness. This can quickly progress to seizures and a coma. Alongside the neurological attack, some patients develop acute respiratory distress, struggling for every breath as their lungs fill with fluid. The statistics are grim. The case fatality rate for Nipah virus is estimated to be between 40% and 75%. To put that in perspective, the fatality rate for the 1918 Spanish flu pandemic was around 2.5%. For COVID-19, it's well below 1% in most places now. A virus that kills nearly half to three-quarters of the people it infects is a public health nightmare. The exact rate varies between outbreaks, depending on the viral strain and, crucially, the availability and quality of medical care. After the initial shock of the Malaysian outbreak, the world hoped Nipah would be a one-off event. That hope was soon dashed. In 2001, the virus emerged in two new countries, Bangladesh and India. Bangladesh has since experienced nearly annual outbreaks, usually occurring in the winter months, coinciding with the date palm sap harvesting season. As we discussed, consumption of this contaminated sap is the primary driver of the Bangladeshi outbreaks. India also saw its first outbreak in 2001 and has had several since, most notably in the southern state of Kerala in 2018, 2021, and 2023. These outbreaks have highlighted the challenge of person-to-person transmission in hospital and community settings. The virus hasn't been limited to pigs as an intermediate host either. In a 2014 outbreak in the Philippines, horses were identified as the bridge between bats and humans. This shows the virus adaptability, and the threat may be more widespread than we think. Scientists have found serological evidence of Nipah virus, or closely related viruses, in the same Pteropus fruit bats in several other countries, including Cambodia, Ghana, Indonesia, Madagascar, and Thailand. This means the natural reservoir of the virus covers a vast geographical area. While outbreaks have so far been contained to South and Southeast Asia, the ingredients for an outbreak exist in many more places, waiting for the right conditions to trigger another spillover event. Given its characteristics, it's no surprise that the World Health Organization, or WHO, has listed Nipah virus as a priority disease for research and development. This list includes diseases that pose the greatest public health risk due to their epidemic potential, and for which there are no or insufficient countermeasures. Nipah ticks all the scary boxes. First, as we've mentioned, is its incredibly high fatality rate. A disease that kills such a high percentage of its victims puts immense strain on healthcare systems and causes widespread panic. Second is its proven ability to spread from person to person. While it doesn't seem to be as transmissible as something like measles or the flu right now, viruses can and do evolve. A strain of Nipah that becomes more efficient at human-to-human transmission is a terrifying prospect. Third, Nipah has a broad range of animal hosts. We've seen it infect pigs and horses. Studies show it can also infect goats, sheep, cats, and dogs. This wide host range creates more potential pathways for the virus to spill over into human populations, making it harder to predict and control. And finally, and perhaps most critically, there is currently no licensed vaccine and no specific antiviral treatment for Nipah virus infection. Treatment is purely supportive. This means doctors can only manage the symptoms, give fluids for dehydration, provide respiratory support with ventilators, and control seizures, but they have no weapon to fight the virus itself. The combination of high lethality, human transmission, a wide host range, and a lack of medical countermeasures makes Nipah a prime candidate for a future pandemic. In a battle against a virus with no cure, prevention becomes our single most important weapon. The strategies to combat Nipah are rooted in breaking the chains of transmission we've discussed. The first line of defense is reducing the risk of animal-to-human transmission. This means avoiding contact with sick animals, particularly pigs in agricultural settings, and steering clear of areas where fruit bats are known to roost. For the general public, safe food practices are paramount. The most crucial advice in affected regions is to avoid consuming raw date palm sap. If it is consumed, it should be boiled first to kill the virus. Fruits should be thoroughly washed and peeled before eating. Any fruit that shows signs of a bat bite or has been found on the ground where it could be contaminated should be discarded. The second line of defense is preventing human-to-human spread. This comes down to basic but vital hygiene and infection control. Frequent and thorough hand washing with soap and water is critical, especially after caring for a sick person or after any contact with animals. In healthcare settings, the stakes are even higher. Healthcare workers must use strict infection control precautions. This includes using appropriate personal protective equipment or PPE, such as gloves, masks, gowns, and eye protection. Any person suspected or confirmed to have Nipah virus infection must be isolated from other patients to prevent the virus from spreading within the hospital, a place that should be for healing, not for amplifying an outbreak. The story of Nipah virus is more than just a story about a single pathogen. It's a powerful illustration of a concept known as One Health. The One Health approach recognizes that the health of humans is inextricably linked to the health of animals and the health of our shared environment. You cannot protect one without protecting the others. Zoonotic diseases like Nipah don't emerge in a vacuum. They are often a consequence of human activities. Deforestation, for example, destroys the natural habitats of wildlife like fruit bats, forcing them into closer contact with human settlements and livestock. Agricultural expansion, particularly the intensification of livestock farming, creates crowded conditions that can amplify viruses and increase the likelihood of spillover. These anthropogenic or human-caused pressures disrupt delicate ecosystems and create new opportunities for viruses to cross the species barrier. Therefore, a truly effective strategy against Nipah and other emerging threats can't just focus on developing vaccines and drugs. It must also address these underlying environmental drivers. This requires a new level of collaboration between medical doctors, veterinarians, ecologists, and environmental scientists. We need to monitor wildlife health, manage land use more sustainably, and improve biosecurity on farms. The One Health approach is about moving from a reactive stance, waiting for an outbreak to happen and then trying to contain it, to a proactive one, where we try to prevent the spillover from happening in the first place. The threat of Nipah virus is real, and it is a stark reminder of our vulnerability in a world teeming with microbes. For now, the outbreaks have been relatively small and geographically contained, but its high fatality rate and its potential for more efficient human-to-human spread mean we cannot afford to be complacent. The lessons learned from the outbreaks in Malaysia, Bangladesh, and India are invaluable. We must use them to strengthen our surveillance systems, to be able to detect new cases quickly. We must continue the urgent research into effective vaccines and antiviral treatments. And most importantly, we must fully embrace the One Health approach, recognizing that protecting forests and biodiversity is not just an environmental issue, but a critical component of global public health. The Nipah virus is a quiet but deadly threat, a warning signal from our planet. The question is, are we listening carefully enough to prevent this regional danger from becoming a global crisis?